It's important to be aware of cancer screenings and the probability of head and neck cancer. Here with more information is radiation oncologist Ambrad and medical oncologist Roopesh Kantala with Ironwood Cancer and Research Centers. Good morning, gentlemen. Good to see you.
Good morning.
Doctor, let me start with you. How common is head and neck cancer?
So head and neck cancer is cancer of the oral cavities, which is the mouth, lips, tongue, the base of tongue, nasal cavity, paranasal sinuses, a short tube behind it called pharynx or the throat, and larynx, which is the voice box. Basically, how common it is, they account for about 4 to 5% of cases in the country. Men are at higher risk than women, 2:1 ratio, especially in the later part of their lives, about 50 years or older.
What are some of the risk factors?
A great question. I think by far the highest risk factor is alcohol, followed by tobacco. Tobacco could be chewing, smoking, or even snuffing. Other common risk factors are HPV. Less common are EBV virus, PON, which is a form of a beetle nut chewing in other parts of the world, radiation exposure, and last but not least, oral hygiene.
Very interesting. Dr. Ambrad, let me ask you, so does HPV cause head and neck cancer, and what's the prognosis?
So yes, HPV is human papillomavirus, a very common virus, but it turns out only about 1% of cancers are caused by a particular strain of HPV. So even though HPV is very prevalent, the cancer strains are not very prevalent in the mouth. But we are finding out about 50 to 70% of newly diagnosed cases are associated with HPV infection now. And This is occurring in younger patients. The silver lining on the cloud, if you will, is that if you have HPV infection associated with your cancer, you actually have a better prognosis. Often the 5-year survival rates for kind of moderately advanced cases is about 80 to 85%, but it's almost half that for patients who are HPV negative.
So how do you treat this?
So for early stage disease, you use either surgery, you can use radiation therapy alone. For more advanced cases, we use chemotherapy and radiation concurrently. We use specialized techniques called intensity modulated radiation therapy, image guided radiation therapy. This allows us to treat patients very effectively with optimally minimizing their toxicities.
And are there any advancements in this at all?
So one of the advancements is the HPV vaccine that's come out, Gardasil. It's basically now approved for up to age 45. It used to be for younger children, and now up to age 45. So we think that's going to have a big impact on the incidence. And then for treatment, the newest studies coming out are going to be using immunotherapy. Those are just about to be published. We're hearing a lot of buzz about them, and that should be an exciting time for treatment of this disease.
Absolutely.
Doctors, thank you so much. A lot of great information for everyone out there. And if you want to learn more about Ironwood Cancer and Research Centers, you can log on to their website, ironwoodcrc.com, or call the number you see right there on your screen.